The day after the apheresis, it was as if I had a different body, and no longer were my lungs an issue for breathing.
So another paradigm shift that occurred over the last 2 years, or maybe 3 years, is that there were certain diseases that were not very common, and there are, as you well know, and you heard this morning, there were new diseases that emerged over the last 3 years. And you can see here that they're somehow connected. All these diseases are connected by the fact that they're associated with infection, which somehow triggers an autoimmune response. And the autoimmune response can affect different parts of the body, primarily the neurosystem. So we find autoantibodies in these patients. We find high inflammatory markers. And in some of these patients, we find coagulation abnormalities. Almost 3 years ago, we published the first report of therapeutic apheresis in long COVID patients. And we described the immunomodulatory effect of therapeutic apheresis in this particular disorder. Next slide. As you can see here, we treated a patient who was wheeled in our clinic. And after the first treatment, he was able to walk out. After the second treatment, he was able to do normal, regular things. And after 3 treatments, he was able to climb stairs and do everyday duties as if he was never sick. We were able to lower all his inflammatory markers, SED rate, CRP, and at the same time, D-dimer. He had coagulation abnormalities. And most of you probably know that ferritin is high in patients with long COVID and COVID, of course. And this is believed to be due to inflammation. Next slide. We did different proteomics. And one thing that is of interest, we knew that from other experiments, but here it showed up again, is during plasmapheresis, everybody believes that we remove proteins. And yes, we do. So there are proteins that are downregulated, as you can see here on this slide. But surprisingly enough, there are proteins that are upregulated. So it happens that the downregulated ones are pro-inflammatory proteins and the upregulated ones are anti-inflammatory. So again, the mechanism of action is very complex during this procedure. Next slide. Here you can see on the left side, before the first plasmapheresis, after the first plasmapheresis, the plasma is really unusually dark. I'm blaming this to the ferritin, but there may be other toxic substances in there. And after the second procedure, the plasma, how it usually looks, transparent, gold-like. The next slide. On the left side is a chest X-rays before we started treatment. This was labeled as pulmonary fibrosis by the radiologist. 2 weeks after we treated this patient, this is on the right side, almost all of this has disappeared. This is very fascinating and difficult to explain, but it's a fact. We have treated several patients with pulmonary fibrosis due to other etiologies, but such a dramatic response I really haven't seen before. I think a few months ago, we examined what we have done with long COVID in our practice, and the symptoms that you all know are fatigue, brain fog, peripheral neuropathy, and anxiety. We treated these patients with plasmapheresis plus low-dose IVIG for 3 weeks with 6 treatments, 2 treatments per week for 3 weeks. And in 65% of the cases, we saw an improvement. Next slide.
I came to Kiprov's office 3 weeks after I had finished the hospital stay. When I came here about a half ago and did the first apheresis, I couldn't walk off of an airplane without collapsing into a wheelchair.
The day after the apheresis, it was as if I had a different body, and no longer were my lungs an issue for breathing. And the difference was truly remarkable. COVID was that I did lose my sense of smell, my ability to taste. My ability to taste was actually, as it came back, it was even weird until the apheresis, and then all of a sudden I was able to taste normally again. And now I notice that I can smell things other people can't smell. But the difference in the apheresis has been really, really dramatic for me.
Next slide.
So I've had essentially long COVID symptoms since I had my COVID vaccine literally 1 year ago, a couple of days ago. Very debilitated. It really changed my life in an instant. I developed pericarditis, neuropathies, brain fog, memory loss, vertigo, visual disturbances, POTS. I had difficulty with my blood pressure, heart rate, ventilation, gastroparesis, menstrual issues, extreme fatigue, shortness of breath, for chest pain, you name it, I had it. And I am a very proactive person, so I've literally tried everything that you could possibly throw at to try to get this better. I've done so many different medications, so many different supplements, herbs.
Another disease that you're going to hear more about over the next day or so is PANDAS. There are a couple of studies, one of which is controlled clinical trial, that shows that plasmapheresis is effective treatment for the disease. Remember, all these patients with PANDAS come to us or to other physicians and undergo plasmapheresis after they have gone through a variety of different treatments, including high-dose IVIG. Next slide. So we had 7 patients. All of them had OCD. 5 of them had tics. 1 had incontinence. 4 of them had suicidal thoughts. 1 of them was unable to eat and drink or refused to eat and drink, and they had to go to emergency room every day to give her fluids, give her saline so that she can survive. All of them improved, although it takes a certain amount of time, sometimes months, until they get. But the improvement is really very dramatic, especially the suicidal kids. Their parents are so concerned and they wouldn't let them go anywhere on their own and all that. It's a very dramatic to see in people. One thing I have to tell you is that PANDAS, it appears, at least in our practice, to be not only a pediatric disease. It occurs in older patients. This last patient that didn't want to eat and take fluids and all that was 21 years old. So today she's 23. She's doing very well.